So, examining children is not the easiest thing a person can do. One, because they're very scared of strangers, and most of them have had really horrible experiences in hospital. And most of those experiences come from receiving vaccinations when they're a bit younger, because of the injections and all that. However, despite the fact that many people find it difficult to deal with children or pediatric patients, there are many ways that you can make them comfortable as you examine them or as you do your procedures. Number one of the most important things we are taught as pediatricians is that we allow the child to be where they're most comfortable. And most of the time, that is usually in the arms or on the lap of the mother or the caregiver, because they already have a trusting relationship with the caregiver. And so you allow the child to stay with the caregiver as you examine the child while they're with the caregiver. And it's important to also call the child by name or ask the caregiver, what name does this child usually respond to? What do you call this child at home? So that you can put the child in an environment that sounds friendly and sounds familiar. The other thing is to ensure that you don't have items all over your office that might scare the child. So don't have obviously exposed needles and things like that, because those are the things that scare them the most. Then, if possible, of course, have a very bright examination area. If you're able to design your room, ensure that you have like cartoons on the wall, bright things that attract and distract the children. Now, one thing I learned from a senior colleague, although some people might not agree with this, is sometimes have something that distracts them on your stethoscope. So this is a small toy that can distract the little ones as you bring the stethoscope to examine them. They really fear this, and this can make them comfortable. Of course, you have to also think about infections and spread of infections. So you try and get something that is not as big as this, and it's something that's easy to clean and disinfect. So if possible, like something plastic and really tiny, that's easy to clean and disinfect, and this distracts them. Some pediatricians use stethoscopes that are very child-friendly. They have cartoons on them, or they have bright colors, and that also puts the children at ease. The other thing is to delay examinations that might be quite difficult, and examinations that children don't like so much, to the very end. So start with the kind of exams that require you to have the child quiet and not crying, like listening to the chest or listening to the heart. And then you progress to other examinations that might require a lot of touch, a lot of pressing. So you start with observation, and then you go to examinations that require quiet, and then you go to the touching, and then finally you end with examinations that children don't like so much, like looking at the eardrum and looking at the throat. So those are small strategies, small ways of making children comfortable when you are trying to examine them, so that you can get the most information possible from the child as you do your examination. So stay tuned for other pointers on how to look after children, to make them comfortable, and to treat them. See you.